Hello everyone, and welcome to your Electronic Health Records course. Today, we'll be going over Chapter 4, Content of the Health Record. Before we get started, let's take a look at today's learning outcomes. When you finish this chapter, you will be able to outline the use of forms for collecting data, understand the procedures of documentation inside Prime Suite, understand the importance of accurate and concise documentation, and use Prime Suite to document vitals. Now, let's take a look at today's key terms, starting with cloning, family history, medical history, surgical history, review of symptoms, social history, and vital signs. Now let's jump right into today's lesson. Let's first start off with forms as data collection tools. If you've gone to the doctor for the first time, they may have you fill out a form. That paper form is similar to data entry in software. Both have fillable fields, and as always, the accuracy is still very important. Information collected on paper forms is transferred to the patient's electronic health record, and these forms are source documents. When creating forms, it is important that the form should be designed logically and in a timely manner. This will prevent errors and missing information. Now, it's important to remember that as much as technology advances, paper forms will never fully disappear. This is because patients may not have computers. Some patients may lack computer literacy and simply just may not know how to work a computer. There are also privacy concerns. And also, using a paper and pen means no technical difficulties if a computer goes down. Common elements in form design include the following. Form name. The title should indicate the type of information being gathered. Facility or office name. Every page of the form should include patient identifiers. Information should be relevant to the form's purpose. Make sure that you clearly mark field names with font style, whether it be bolding or italics. Related pieces of data should be close to each other. Separate lengthy forms into sections and multiple forms. Forms should flow well and be easy to follow. Each piece of data is only requested once. Make sure you leave room for each field, and avoid duplicating questions or information. Paper forms are often the source documents used to enter into the electronic medical record. If this is the case in an office, the office policy must reflect what is considered the primary record and what will be done with the paper once the data is entered into the EMR. The options include keeping versus destroying, immediate destruction, and a procedure for proper form destruction, and this is to protect patient identification. Now, these options include keeping versus destroying, immediate destruction, and a procedure for proper form destruction, and this is to protect patient information. So let's stop and think. Why is it important to destroy paper records after use? What are some acceptable methods of destruction? Well, let's remember the type of information that is sometimes listed on these forms, such as the address, social security numbers, and health information, is all sensitive information. So making sure that information is destroyed so no one else can see it is very important. Now, when I think of an acceptable method of destruction, I automatically think of paper shredding. Next, let's discuss the past medical, surgical, family, and social histories. Past medical history, or PMH, is a record of past medical history. It contains information about the patient's health status, past and current medical conditions and symptoms, dates of onset and resolution for each medical condition, known allergies and their reactions, immunization status, current list of medications, including the name, dosage, frequency, and reason, and PMH also has a review of systems, which consists of a body system inventory of a patient's symptoms and is determined by questioning by the care provider and sometimes from questionnaires. Next, let's discuss the patient history form. This often includes the patient's current condition and their chief complaint. This is the reason the patient visits. Patient history also includes the history of present illness. For example, the location of the condition, such as where on the body is the issue, the type of pain, whether it is dull, throbbing, aching, sharp, or radiating, the duration, how long the patient has felt these symptoms, and the associated signs and symptoms, which are other symptoms that occur as a result of the main complaint. So stop and think to yourself, what is the importance of a highly detailed history of present illness? To me, I think the more you know, the better. Knowing the details of the illness will allow for better treatment of the illness. Next, let's discuss surgical history. The surgical history includes previous surgical procedures that the patient has undergone. This includes the name of the operation or the procedure, the reasons for the procedure, the approximate date the procedure was performed, the name of the surgeon who performed the procedure, and the anesthesia reaction or any complications. So stop and think. Why do providers need to know a patient's surgical history? Think of examples of when the information might be helpful. So stop and think. Why do providers need to know a patient's surgical history? Think of examples of when this information might be helpful. Well, knowing information about the reason for a procedure and if there were any complications can help the doctor determine if any of the current issues a patient may be going through are a result of that surgery. Next, let's discuss family history. Family history is a documentation of conditions and diseases found in immediate family members, including the name of the conditions, the family members with the conditions, and the deceased family members with causes of death. Family history is very important because it alerts the care providers to conditions that may affect the patient's overall health, now or in the future. It helps identify familial risk factors for various conditions and can help in making diagnostics and treatment decisions. Next, we have social history. This is the social and lifestyle habits of the patient. It can include their smoking history, past or current, and frequency, use of alcohol or illicit drugs, past or current, and frequency, their socioeconomic class data, including their occupation, education, and marital status. The social history also includes the sexual activity and use of protection against sexually transmitted infections and diseases, as well as exercise and physical activity. So stop and think, how can a patient's social history be used as a source of patient education? Well, like I mentioned earlier, the more you know, the better you will be able to treat a condition. The more you know about a patient's social history, the better you'll be able to inform them on health information they may need to know. Next, let's discuss cloning. And when I say cloning, I'm talking about copying a file and then editing in and out the difference. Electronically copying similar or identical information from a previous encounter of the same or different patient. It allows for speed of record completion and increased efficiency. It is also known simply as copy and paste. So stop and think. When cloning patient encounter, why is it important to pay attention to detail and ensure accuracy and completeness of the documentation? How could it be considered dangerous? Well, the first thing I think of is accidentally deleting important information, resulting in the information being incorrect. I think of copying and pasting the wrong thing into the wrong document, and also accidentally duplicating information. Next, let's discuss handling inconsistent or unclear information. Sometimes patient information is unclear or even contradictory between forms and verbal accounts. When information is unclear or inconsistent, it is necessary to question the patient to determine the facts. You can do this by instilling trust in patients. This is a good strategy for communication, not just with patients, but in general. And communicating the rationale for the questions can assist patients in becoming more comfortable. You want to make sure that discrepancies are documented accurately and concisely, and written policies should be in place to address how these situations should be handled. Remember, medical records are legal documents, and there are a set of standards for documentation that ensures the quality medical care is being given to patients. Those standards include accuracy, precision, reliability, and consistency. Documentation can be amended, added, or deleted without compromising the record's integrity. Now remember, any changed information is still retrievable within the electronic health record. And like I said earlier, remember, medical records are legal documents. Next, let's discuss documenting vital signs. Vital signs which are taken by healthcare professionals during the encounter. These measurements are taken to determine the status of basic body system functions, like temperature, heart rate, respiratory rate, blood pressure, and oxygen saturation. Other measurements are often included with vital sign recordings. For example, height, weight, and body mass index. Now lastly, let's go over vital signs in Prime Suite and other EHR systems. Vital signs are typically documented in the patient's face sheet. By doing this, you have the ability to track vitals over time and look at them graphically and chronologically. Now stop and think. How can vital sign tracking assist practitioners in providing quality healthcare to patients? Well, because of what vital signs measure, heart rate, respiratory rate, and all the things we mentioned in the previous slide, they on their own are a good way to check the health status of the body. But being able to track this information over time allows the doctor to see if the patient's health is improving or getting worse, and they can monitor the progress or decline of a patient more precisely. That concludes today's lesson. If you have any questions, feel free to reach out to your instructor.